Hello everyone, I'm Urologist Erdem Akkaya. Today our video will be about testosterone deficiency. I receive many messages on this subject. For example, they tell me their testosterone level and ask if they have a deficiency. In the case of testosterone deficiency, one of the most important things for us is whether the patient also has complaints such as loss of sex drive, erectile dysfunction, decreased sexual performance, fatigue, and malaise. For us to say that there is a testosterone deficiency in particular, the patient must have a loss of sex drive and erectile dysfunction. Because with testosterone levels below 300, the patient may not have any symptoms. In other words, we may find that young people with testosterone levels between 200 and 300 sometimes have no complaints when they come in for routine testing. For example, the testosterone level is 233, but the patient has no problems, neither erectile dysfunction nor loss of sex drive. The important thing here, as I said, is that the testosterone level is below 300 or 350 and the patient has complaints. Because there are many other diseases that can cause these complaints. For example, hypothyroidism can cause the same complaints. And while we are evaluating erectile dysfunction in a patient, it is necessary to do many other tests besides testosterone, to look at the hemogram, to look at the kidney functions. In cases of loss of sex drive and erectile dysfunction, many things need to be investigated at the same time. Not all patients with testosterone deficiency improve when they receive testosterone therapy. In other words, in some people, levels below 300 are actually the normal level, meaning that this person can live normally with a level below 300. This person already has a testosterone level below 300, but when erectile dysfunction develops, we only learn that the testosterone level is below 300. If you give this person testosterone treatment, for example, it may not work very well. There are also publications that say the opposite. For example, there are publications that say that 50% of patients with testosterone levels below 400 benefit from testosterone therapy. And sometimes people come. For example, he says he's been going to the gym for 2 years, but he has not been able to get a response in building muscle. And the patient's testosterone level is 200. If you try to get the testosterone to the upper limit, to levels of 1000, by keeping everything under control in these people, muscle building actually occurs. But is that a medical application? Is it a medical indication? Is there such a medical indication in the world? No. Here testosterone is actually used for anabolic purposes. It would not be correct to call it testosterone replacement therapy. Because these people do not have erectile dysfunction and loss of sex drive. These people are using testosterone for anabolic purposes, for muscle building and for weight loss. That being said, as stated, many people may have their testosterone levels routinely checked and come to us confused. Therefore, just having a testosterone level below 300 and not having any symptoms does not suggest a testosterone deficiency. It is not correct to speak of a testosterone deficiency. Thank you very much for listening, with kind regards.